Alright, so let's talk about the heart. So, your body needs blood to complete its daily activities. Blood flows through the heart specifically in a pattern. There are four chambers, known as atriums and ventricles, in the heart that regulate blood flow through the heart. You have the two atriums and the two ventricles. The heart also has four valves that keep blood moving in the right direction, so it doesn't go backwards, cause a backflow, and cause other heart problems. Now, looking at this, we have blue. Blue is unoxygenated blood, and red is oxygenated blood. And that's important because now let's take a look. Arteries, two key things to remember. We have arteries. Arteries bring blood away from the heart, and veins bring blood back towards the heart. So starting from the beginning, we have upper limbs. So blood comes in from the upper limbs, like your head, your neck, head and neck through the superior vena cava, and blood also comes in from the lower limbs, like your legs, through the inferior vena cava. That usually carries carbon dioxide and waste as well. So you bring all that in, all that pools into the right atrium and travels through the tricuspid valve, which is known for having three flaps, into the right ventricle, where it is then carefully pumped through the pulmonary valve into the pulmonary artery and taken away from the heart. The pulmonary arteries eventually split into left and right pulmonary arteries, and that brings blood to the lungs to get oxygenated, removing waste and carbon dioxide. The oxygenated blood then comes back in through the pulmonary veins and dumps itself into the left atrium. From the left atrium, the blood then goes through the mitral or bicuspid valve into the left ventricle, and that goes then through the aortic valve into the aorta and redispenses back out to the body. Now fully oxygenated and ready to deliver oxygen to the organs and tissues involved. Now, this blood flow is important because it helps in determining how efficient the heart is, allowing us to diagnose conditions like heart failure, high blood pressure, etc. And this is something that they always monitor. You ever go into a physician's office and they use the sphygmomanometer, the little thing that they put in their ears with the little round thing on the end, and they check your breathing and your heart rate? That's what they do. Also, blood pressure machines measure this as well, so it's important to keep all of that in mind.